Module 1, with its objective to provide foundational knowledge on the role and importance of community health assessments, CHAS is well aligned with best practices for introductory CPD modules in public health. It establishes the essential context, relevance, and core concepts necessary for effective learning and future applied health practice. Module 1 serves as an effective introduction to the CPD course, Community Health Assessments, by focusing on foundational knowledge of what CHAS are and why they matter in public health. This approach is consistent with educational best practices, ensuring that learners understand the definitions, scope, methodologies, and critical importance of CHAS before progressing to more advanced topics. By grounding the course in the real-world impact and necessity of CHAS, Module 1 sets the stage for meaningful engagement and practical application throughout the CPD program. Module 1 aligns with public health practice by introducing CHAS as systematic processes for identifying community health needs, assets, and determinants, which are essential for public health planning and intervention. CHAS play a critical role in evidence-based policy, resource allocation, and health equity by informing interventions, fostering community engagement, and supporting continuous improvement. The module addresses core functions of CHAS, such as identifying health needs, informing policy, promoting equity, and supporting resource allocation, by emphasizing systematic assessment concepts, stakeholder involvement, and data-driven decision-making. Module 1's focus on foundational knowledge aligns with adult learning principles, emphasizing relevance, immediate applicability, and self-directed learning. Adults engage more deeply when they perceive the utility of new knowledge, making the module's emphasis on real-world CHAS applications particularly effective. By starting with definitions, context, and importance, the module ensures accessibility for learners with diverse backgrounds and prepares them for more complex content. Its objectives, defining CHAS, explaining their significance, and outlining their role, are appropriate for an introductory level and support measurable learning outcomes, fostering engagement and retention. Content coverage. Module 1 covers essential content and employs a strong pedagogical approach to introduce CHAS effectively. It defines CHAS as systematic processes for identifying health needs, assets, and determinants, emphasizing their importance as a foundation for public health interventions, policy, and equity. The module highlights core components like data collection, community engagement, prioritization, planning, and evaluation, while exploring methodologies such as quantitative, qualitative, and mixed methods. Real-world impact is demonstrated through case studies, showcasing CHA-driven improvements. Pedagogical recommendations for Module 1 emphasize the use of interactive elements and assessments to enhance learning. Incorporating case studies, group discussions, and reflective exercises helps contextualize foundational concepts, making them more relatable and engaging for learners. Additionally, formative assessments such as quizzes and reflections reinforce learning by identifying gaps and ensuring comprehension. These strategies align with adult learning principles, fostering active participation and deeper understanding of community health assessments. Community health assessments CHAS play a critical role in public health by ensuring evidence-based practices that align interventions with actual community needs, avoiding ineffective or misaligned programs. They foster community empowerment by engaging stakeholders and residents, building trust, legitimacy, and sustainability. Additionally, CHA findings support policy development, resource mobilization, and compliance with regulatory requirements, making them vital tools for effective public health planning and impact. Key point: without a strong foundation in the role and importance of CHAS, public health professionals risk implementing interventions that are less effective, less equitable, and less sustainable. To sum up, Module 1 is a well-designed introduction to the CPD course Community Health Assessments. By focusing on foundational knowledge of the role and importance of CHAS, it aligns with both public health practice and adult learning best practices. This approach ensures that learners are equipped with the essential context and understanding needed to engage deeply with subsequent modules and to apply CHA principles effectively in their professional practice.